Good evening. My name is John Hansman. I am our board chair. Tonight is our general board meeting for the month of September 2023. So welcome everyone. At this point, we'll start with a roll call.
Present.
Mr. Cohen. Mr. Torres. Pastor Jones, he sent me a notice that he would not be able to attend.
Same thing for John Paul. He sent me a notice that he would not be in attendance tonight.
Dr. Hans. Here. Ms. Newman. I know she's here. Okay. Ms. Root. Here. Ms. May. She sent me a note she might be running a little late. Ms. Woodruff.
Here.
Dr. Giles. And Mr. Landsman.
Here.
You have a quorum.
Thank you. Next up on the agenda is doing the Pledge of Allegiance. So we'll stand and do that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next on the agenda is public comment. So 3-minute duration per person for any topics that are related to our organization or the services thereof. And I'm paraphrasing our policy that's up on the wall. Is there anyone locally that would like to make public comment? Not hearing anything before we move to remote. I just want to note that Melkaya Newman is here for attendance. Okay.
I do have a public comment that was submitted in writing, but was not, that they're not going to be able to be present, so I'm printing it out and I'll hand it to you guys.
Okay.
In accordance with the new policy.
Okay, thank you. Is there anyone that's remote that would like to make public comment? Not hearing anything, we will have a second opportunity for public comment later in this meeting. Next on the agenda is my favorite topic, which is stories that inspire. And tonight it's the APAF Community Diversity Fellowship. So presenting that is Dr. Pozio and others, I would think, yes. So we'll give you guys a minute to get settled and make sure the mics are working. And thank you guys for coming.
Oh, there we go. Good evening. I'm Dr. Pozio, Chief Medical Officer here at OCHN, and I am very honored to be joined by our brand new Community Diversity Fellows, who I'll introduce shortly. But first, I wanted to talk a little bit about what the American Psychiatric Association Foundation is, and a little bit about the fellowship. So the American Psychiatric Association Foundation is the philanthropic arm of the American Psychiatric Association. And they fund a number of fellows, typically psychiatry residents, psychiatry fellows, and psychiatrists in early career in a number of areas. And the newest fellowship program funded by the APAF is the Community Diversity Fellowship. The Community Diversity Fellowship provides a psychiatry resident from diverse backgrounds with leadership, networking, and mentoring opportunities, as well as a field placement component designed to add impact in the delivery of culturally competent psychiatric care across hard-to-reach and traditionally underrepresented communities. We are very honored to have 3 fellows this year. Much of that has to do with just how highly the American Psychiatric Association Foundation regards OCHN and regards our CEO, Ms. Lazenby. And so we're very fortunate to be in a position where I thought we would have 1, but we were blessed with 3. Next slide, please. And so to introduce our fellows, to my right is Dr. McLean. Dr. McLean is a PGY3 postgraduate year 3 psychiatry resident from the Authority Health program in Detroit. Dr. McLean, would you like to introduce yourself to the board and kind of talk a little bit about your career interests and what you're hoping to gain from the fellowship over the course of the, I forgot to mention, 2 years they'll be with us. Press it and hold it until it turns red. Or you can use mine.
Good evening, everyone. Thank you for having me this evening. It's a pleasure. As Dr. Pozios mentioned, my name is Dr. Tamara McLean. I'm a 3rd-year psychiatry resident at Authority Health in Detroit, Michigan, and I'm just excited to be a part of this inaugural fellowship program through APA and through OCHN. For me, it resonates because community-based mental health care is a big reason why I'm at the program I am now, because that is our focus, and we work in and around the surrounding Detroit areas. Also, another area and passion of mine is in the child and adolescent community, so my hope is to kind of combine those 2 areas in my future work as a attending upon completion of my training. So thank you for having me.
Thank you, Dr. McLean. And next we have Dr. Deanna Vaughn, who's joining us virtually. Dr. Vaughn is a PGY3 psychiatry resident from my alma mater, my program, University of Michigan in Ann Arbor. And Dr. Vaughn, would you like to just talk a little bit about yourself and your interests?
Yeah, absolutely. Thank you guys for having me. And I'm really sorry I can't be in person. I actually just finished like psychodynamic supervision, and so Tuesdays are a bit busy. But
I've been there.
Yeah. But I really am glad to be working with your organization. I started off in surgery, but it wasn't quite the best fit for me, and so I finished that residency and switched to psych. And I've been so happy and feel like I get a lot of meaning and satisfaction from what I'm doing right now. But I think part of the reason I applied to the fellowship was I felt like there was a portion of the population that was a bit invisible. I feel like we had a lot of patients with really good insurance who would come in, and you kind of had a really good sense of what would happen when they left the inpatient unit. But for other people, I felt like I didn't have a good sense of what happened to them, people with serious mental illness, no insurance, kind of like weren't functioning too well. I didn't have a great sense of what happened once they left. And so my hope in working with you guys is to kind of get a better sense of what happens with this population of people that I don't see too often through the university. I'm interested in child, but I don't know, I'm starting to really enjoy addiction more, which is like a change. And so at this point, I don't know where I'm headed, but we'll see kind of where I go from here.
Well, maybe we'll try to help you figure it out, Dr. Vaughn, but glad to have you. And next is Dr. Kyle Lalk. I don't know if Kyle has been able to join us yet. Dr. Lalk, are you there?
Hello? Sorry.
Hey, Dr. Lalk. So Dr. Lalk is a PGY3 psychiatry resident at Henry Ford Health System in Detroit. And Dr. Lalk, would you like to tell the board a little bit about yourself and what your interests are?
Yes, so again, I'm Kyle Locke. I'm a PGY3 at Henry Ford in Detroit, Michigan. My main interest in psychiatry, I'm very interested in consult liaison as well as integrative medicine, kind of integrating both primary care and mental health services more in the community setting. I'm originally from Michigan, grew up in a very rural area, so another particular area of interest of mine is rural medicine, especially, mental health services for the underserved rural population that don't really have access. And then I also have a strong passion for the LGBTQ plus community.
All right, great, thank you. So, one of the main purpose of this fellowship, when it kind of all gets distilled down, is to really support an interest in community psychiatry, community mental health. And as you hear, each of the fellows have arrived at psychiatry from different perspectives. Some have had different careers, even in medicine, and have come to psychiatry because they really value that connection with people and wanting to help people who are not always served to the highest level in society. And so, in addition to giving them some experience to how the CMH system works, trying to support their interests and their career trajectories by giving them experiences to get involved in and shadow some leadership opportunities that I have. So one of the meetings that the fellows have the opportunity to be involved in is my medical directors advisory group meeting, which of course the medical directors from our provider network attend on a monthly basis. The Oakland County Health Equity Council, the Oakland County Prosecutors Commission to End Gun Violence. And there are various events that occur in our provider network, training opportunities, education opportunities, but also community events. So Dr. McLean had the opportunity to attend our community threat assessment training recently. And also, I believe, earlier today at the Vax Bash at CNS. So, just trying to get the fellows as much exposure to our system as possible. And of course, there is a clinical component to the fellowship, very small part of the fellowship, but still about a half day a week. Our intention is to have the fellows rotate over at our new Youth and Family Care Connection, which is particularly relevant for the fellows like Dr. McLean, who has an interest in child psychiatry. Part of the fellowship also allows for the fellows to attend the APA annual meeting and one subspecialty meeting during per year, I believe. So again, the fellowship is for 2 years. The fellows will be with us for 2 years, so you'll probably be seeing them again in the future. And again, just very honored that we have the opportunity to be able to mentor these young psychiatrists and show them how wonderful it is to work in this system. And with that, I'm happy to take any questions if anyone has any.
Go ahead, Dennis.
Dr. Posio, you might have said, and I just didn't catch it, how long is the program that they're going through?
It's going to be for 2 years.
2 years.
Mm-hmm.
And then do you have plans already for what you'll be doing afterwards, or you just kind of finding your way?
So So I know each of us kind of have different plans. My plan is to do a fellowship in child and adolescent psychiatry,
Okay.
so which will actually start the second year that I'm in this program, because that's a 2-year fellowship. So.
Okay, wonderful.
And I believe all three of our fellows are interested in subspecialty training. So child psychiatry, addiction psychiatry, and possibly consult liaison psychiatry.
Well, thank you for coming.
All right, well, if there's no further questions, then I would like to thank Dr. McLean, Dr. Vaughn, and Dr. Lulk, and I look forward to working with them over the course of the next couple of years. So thank you all for having us.
Thank you. And again, welcome. Next on the agenda is the board chair's report tonight. Unusual, but I will be fairly brief. Our executive committee met at our usual fourth Thursday meeting on August 24th. We covered 2 topics. One is the meeting agendas, where we reviewed and approved the tentative agendas for this month's study session, including last week's committee of the whole, tonight's general board meeting, and next week's study session. As well, the second item that we covered was the CEO contract, where we had met with our outside attorney regarding the contract. It included a closed session that's allowed under OMA to discuss terms and conditions and compensation and benefits package. Since that meeting, we've met twice more to work through the open items and hope to reach an agreement soon. After the COW meeting on September, we had another meeting after the COW meeting on September 11th, including a closed session, and then again this evening, before the start of this meeting, we had another board meeting, another board meeting that included a closed session. As the board may recall, at last month's board meeting, the board approved a 2-month extension to Dana's existing contract. And given the speed we're moving tonight, when we're at other business, I'm going to ask for a motion to extend for another month during this negotiating process, if Dana, you find that acceptable. Well, it's hypothetical, but I'm hoping that we will reach agreement well before that, but we want to make sure there's room to do that, because our next board meeting is basically more than it. Our 2-month extension will have expired by then. Okay? So. I will have to follow up with my attorney. Okay. All right. The only other item that I have is on CMHA news and reminders. At this point, we have 3 of us attending the fall conference, plus Dana, I think you're planning on going as well. We actually have 4 voter ballot slots for our board, so I'm hoping that there may be a 4th person that can make it up to the fall conference. That's Sunday afternoon through Tuesday afternoon in Traverse City, October 22nd through the 24th. There's lots of workshops. It's an excellent way to gain knowledge about various aspects of the operation of a CMHSP along with a PIHP. So you'll get to know, what we do in a different perspective than what you hear about at our board meetings. As most of you know, we are both a PIHP and a CMH. But it also gets you a chance to meet with some of our staff and other board members outside of the normal business meetings, which is really good, and to meet with others from other entities across the state. So I'm hoping that we'll get at least one more person to join us. With that, I'll conclude my report. Thank you. Next up is the Policy Management Committee Chair report. Okay.
I don't have a report. I don't know if Yvette has a report.
At our last meeting, a compliance update was presented by the quality manager, Ms. Massey, and questions were asked and they were satisfactorily answered. The annual plan was not reviewed during that meeting because it had been reviewed during the study session and is scheduled to be presented again at the board meeting. And that concludes what happened with policy at the last meeting.
Thank you. Also up would be the Finance Committee's chair report.
Thank you. At the Committee of the Whole meeting last week, we reviewed contracts, and 8 of those contracts are before you this evening with the recommendation for approval, and also our annual budget, which would go into effect October 1st and is required by law, is also on the agenda this evening, and also we recommend the adoption of the budget. That's the conclusion of my report.
Were there any contracts that you guys did not want to support?
That we did not what?
Did not want to support in reporting?
No, I believe all the
All 8?
contracts were
Okay.
approved. Yeah.
All right, thank you. Next up is our July financial trends update. Mr. Franklin. Boy, everyone's in a suit. I feel like I'm a bit casual tonight. I'm sorry. Can you check the mic, please? May not be on. There it is.
This is the update for the July financial trends update. The first slide shows the MDHHS payments. It shows that when we show an increase in revenue, and particularly in months May, June, and July, it stands out on our graph as a spike. We budgeted for these increases. Extra revenue was accounted for in our BA2 amendment budget. Next slide talks about the eligibles. Eligibles, they remain constant. They've been consistent all year. Throughout the year, coming out of public health emergency, however, and coming into this first year of CCBHC reporting, we experiencing rate changes, and we addressed that during the coming budget, where we show that we reduced our budget by 21% based on the eligibles that we're anticipating. But this year it's been consistent all year. But next year, based on the eligibles, which has always been something that we've been paying close attention to, we're expecting a 21% decrease in fiscal year 24. However, in October, our consultant will be here and to help to share some information that, that's consistent throughout the state. It's not just affecting Oakland, but it's affecting all of the PHPs throughout the state. And so he'll be able to shed some light on a lot of the eligibility trends and various things on next month's meeting. The next slide we're going to talk about is the asset comparison. One of the main things we've done, earlier on we mentioned to you about the accruals versus the actuals, and we were able to pull out a lot of the accruals out of the reporting financial statements. As you recall, in March, we budgeted for an $8.9 million shortfall. So we removed all the accruals in order to reflect what our actual budget, real-time actual expenses are. So accrual meaning that we didn't record the revenue that we had not received and some of the expenses that had not yet occurred. And so what you see in this asset reflects a lot of the changes to the actual versus accrual that was done. The next slide, it talks about our liabilities. This category went down, mainly in every category. Liabilities, when that go down, that we're paying the bills on time, because all of our categories of liabilities went down. Vendor payable, due to state, employee payables, and long-term debt. they all showed a decrease. Next slide. This Medicaid is one of the main things that make up our funding. That's one of our number one fund sources. We pushed most of our funding out to our providers, and because of that, we overspent in Medicaid. We've done that last year, and we're doing it again this year. We're showing a trend of overspending in Medicaid as well. But you know, we were diligent in ensuring that we had a continuum of care for the people that we serve, and you know, due to the health emergency, we were making sure that we ensured that stability payments went out. We had a lot of providers on cost reimbursement, and so we made sure that the network was taken care of, and because of that, we overspent in that area. So our liabilities and our net position has changed. We provided these behavioral health services, even included SUD as well. We showed a shortfall overall in the funding for this period from October 1 through July 31st. Next slide talks about the Medicaid year-to-year comparison. It shows where we were and what revenue we received in fiscal year 22 versus what was received in fiscal year 23, year to date. In comparison, you see that the revenue for 23 has always been higher. In funding, it has, you know, trended higher. A lot of that is due to CCBHC funding, which is we manage the CCBHC funding. We push it through to providers, and we receive a 1% admin fee for the services. A lot of, not only that, but it also mentions the revenue comparison, talks about this, it compares one year to the other. So each year, all of our revenue pretty much stayed the same in every other category, but you do see a big increase in the Medicaid portion. Next slide. So this is the expense portion. So it's compared, not only is the revenue higher, but also the expense portion is higher. We can continue to push out more dollars for services in an effort to, like I mentioned before, cost reimbursements, stability payments, staffing, direct care wages, and various other funding methods in order to stabilize and ensure that the network was fully funded properly. And then the next slide talks about net income. Per VA2, we budgeted for 8.9 million shortfall. Right now we're showing this, and this comparison is really not a true comparison, what I would say, because a lot of the prior year had a lot of accruals, whereas this year report does not show it. So when you remove it, it kind of changes the comparison on what we're trying to accomplish. But nevertheless, we do show a $11 million shortfall as of 10 months of operations, or 10 months of activity. So a lot of funding, special funding, has gone into providing stability. We manage the network. We're the risk for the network, and so we have to make sure that OCHN has a healthy fund balance and that OCHN has a healthy sustainability plan. And so I know this year we pushed out stability payments, but effective 8/31, we put out, all providers know that that was the last day to submit stability requests, payments for stability requests. And also most of the providers have come off cost reimbursement. And so it's a change and a shift in how we're funding providers this budget, but we're already showing a shortfall because we pushed out dollars for services. And so by us holding the risk for the network, we have to make sure that we're financially stable. We fund it adequately in most cases, overspent in services, and our admin budget still stayed below 7%. So we did all of this, and we kept our financial house in order internally. But so in review, there were several things: a direct look at the accrual base versus cash base. We did analytics last month because we wanted to make sure that the report we were presenting to this board was as accurate as we could get it. We wanted to make sure we looked at why the GL and the OCHN reporting have variances in order to, just present the most accurate financial report that we could. And we also took in consideration where we are real time July 31st. So there's no surprises. We had a accrual that was for CCBAC. We owed that money because of the rate. They adjusted the PPS1 rate and made it retro to 10/1. So we owed to the tune of about $10 million to the CCBACs for that retro amount. We made note of that in the financials to show because that wasn't paid out as of July 31st, but we accrued it to show you what it would look like with that payment. Had we not made that accrual for that amount, it would have showed a balanced budget and then we would have had a spike in the last 2 months. So we wanted to be as transparent as we could in presentation of these financials. I believe I got one more slide. It talks about the top 15 providers. I think they kind of stay the same. They've been kind of consistently the same throughout the course of this fiscal year, but they are listed on our screen. There's a lot of detail that go into the statement of activities and reports that I could, provide details to questions that you might have relating to anything that I talked about in this presentation.
Okay. Thank you very much. Are there any questions by any of the board members? Yes, John.
Patrick, thank you for the detail and for also for cleaning up so we know exactly where we're at. On the you mentioned a couple times about the cost-based reimbursement. Was that most of the providers or some, or ballpark figure? How many were we doing that with in the past?
Most of all the providers had some form of incentive and cost-based reimbursement, SUD, SED, vocational, specialized residential. So every service that we touch did well during this year. OCHN did. We made sure that all the provider networks were funded well.
Okay, thank you.
Yeah. Anyone else with a question? Dennis?
Patrick, thank you. And it has been a, up and down year with all the changes that we've had and change in funding and some of the money we had before is going away, and we got to tighten our belts, and and I know actions have been taken on that regard. You and I talked earlier about the fact that we have money in an unrestricted surplus, so to speak, and I forgot the exact, I don't want to say it wrong, which fund it was.
The unrestricted
Right.
PA2.
Right, and we can transfer that money to cover the operating deficit that we had this year, right?
That's part of our
Okay.
plan.
Right, but we do have to go, you mentioned, to the Oversight Policy Board.
That's correct.
In order to do that, and those funds, as you indicated, or we had talked to Dana about it, is that some of that is, you know, in hindsight, a lot of it went through Medicaid, but it could have went through that fund. So it's all going to the same types of services. So it's not like we're there's no, everything's appropriate about making this transfer, and it hasn't been done in the past. So I'm glad that, you know, we had kind of holding that money in abeyance this year, that we'd have that money to cover an operating deficit, because we just didn't know where things were going to go. So the money's there, just that it has to be transferred in order to account properly for it. So,
That's correct.
you know, I wanted to point that out to the board that, like I said earlier, with all the different impacts that have occurred this year on expenditures and the budget, the good thing was that this money was held in abeyance, and that money did not go out the door, so that we had a little bit of a cushion to apply if there was an operating deficit, which we actually budgeted for earlier in the year. Again, this was in an effort to get as much money out to the individuals that need it, as well as support the provider network, which was still feeling some of the after effects of COVID. That's over now.
Mm-hmm.
Everybody's been informed. It's a different program now. We don't have that kind of money, and everybody's got to tighten their belt.
Yep.
But I'm glad we do have those funds available, and you'll go before the board this week and hopefully get their blessing, so that we can balance the book, so to speak. So thank you.
And we were prepared to go before the board, I believe it was last week, and they didn't have a quorum that meeting, right. But we do plan to have.
Tell them we need a quorum this week.
All right.
Thank you.
Thank you.
Sir?
There we go. Okay. Thank you for your report. I was just wondering if we could explain why provider expenses went up so much. I mean, it's over 61 million. And I sort of get the fiscal year versus calendar year mixed up, but I thought that direct care wage increase was in fiscal year 2022 also. No,
it's just
it must,
continued.
okay.
Yeah, it's direct care wage is something that's been established in the rate. And so whatever it was in 22 is continuing in 23. And so, yeah, that's.
So with a direct care worker shortage that we all know we have, how are expenses going up by so much to providers?
Well, okay. So first of all, some of that is CCBHC dollars. So when you see the expenses, the revenue went up a lot, but you got to realize 52 million of that is CCBHC dollars. And so our funding went up and our expenses at the tune of about 52 million based on CCBHC. That's part of it, yeah.
I mean, we're showing funding went up by a little over 30 million.
Well, you know what,
For
it's
just
30,
Medicaid,
it might
but
be
that's
31
including-
in 23 and 52 in 24, I believe. Okay.
Well, I'm staring at it. I'm just looking at the expenses that went out to provider networks and looking for maybe an expanded explanation on why between fiscal year '22 and then so far this year, we've already spent over 61 million paying providers. When
Is that the report is that this?
yeah, it's that one.
So I mentioned in my report that it's difficult to compare. This is not a real accurate comparison because all of this accruals that was in the previous year's budget. We took out a lot of accruals for FY23, so you're not going to get a real good, accurate year-to-date comparison. So, does that make sense?
So does that mean that last year, those amounts were 1/12? Because those are accruals, and this year, where we went to actuals each month, is what we're paying them, and so we're seeing higher billings, so we're paying them more?
If I may. Two things, or just, there's more than two things, but simply to answer your question, Ms. May, part of it is that although we had a workforce crisis, the folks that we did have working, we had to increase their rates, and they did a lot of overtime. So of course, we wanted to make sure that our providers continue to provide those services, so we had to push that funding out. The other part of it is having to do with how we reimburse providers. We did a lot of cost reimbursement based on previous or historical cost, and so we continued to do that until we moved them back to the service models, in which I think we also talked about how often those FSRs, those financial status reports, were being reviewed, and so we weren't catching the trends as quickly as we should have, but also our system was changing. So a lot of the stuff that we were doing, now we're trying to do a cleaner report. So there's some things that appear to be off, but we're catching it up, and we're making sure we're reporting to date what we actually have accrued and what we have actually paid out. So if you think about the July report, we're just doing it now because it takes time to take those things in and pay those bills. So as our system gets better and we look at how we fund our providers, this should be a much better budgeting process, because we also have a provider stability payments that were going out when providers exceeded their not to exceed amounts in their budget. So there were times where providers could not make payroll or they couldn't cover their expenses, and they would come to us and request an extension of their budgets. And we, because we wanted them to continue to serve people, would pay out those dollars.
Dr. Hans.
I want to thank Patrick. Thank you for this report, very transparent, and even though some of the things we don't like to hear, but at least we know where we are in real time. That's reassuring. But I also want to say that our utilization systems have to be updated and quickly, because we don't want to be in the same spot every 3 months, or as we come closer to the end of the year, it kind of gets very, very nerve-wracking, not only for us, but also for the people that we serve, because they are really, I don't know, I don't understand all the nuances myself, and I think it causes more confusion among the people that we serve. So I hope that we will be up to speed soon, and I hope that we will get just as good reports from our utilization as we get from the finance. Thank you.
Other questions from board members?
Well, just, Patrick, can you, when were we doing FSRs before and what are we doing now? Can you remind me of I know it's much more frequently now than it was. What's the change?
Quarterly is when we're requesting them. And some providers have to submit them more frequently based on if they ask for a stability payment or something where we have to reconcile what the ask is against what funding amount that we receive, but they're sending in the FSRs more frequently now.
So quarterly or more frequently versus twice a year or less frequently?
Yes.
Which is part of, I mean, in some ways, it's challenging because we're looking at a very to the day budgeting reports versus, I'm going to generously say, quarterly numbers that were broken into per month. We're taking a Polaroid of a speeding train versus a Nikon camera.
I had one question. I had one question on one of your first slides, so just before the eligible slide, you mentioned that we had revenue that was up for May, June, and July. So right there, the revenue.
Yes.
And I was trying to catch why the revenue was up for those 3 months versus the other months, where they're relatively flat.
A lot of it was this CCBHC catch-up dollars. Once we got notification from the state in May that it was retro, they did fund. They sent funds along with the increase to retro.
So is that part of the? I'm really not good at colors here. This one is showing DABs and TANFs and Healthy Michigan. So I was trying to figure out which group got bigger because it's above the.
And that's part of supplemental and the payment that we get, because a lot of the CCBH money is sent in our regular capitation payment. So I know previously one of the board members asked about showing the expenses for CCBHC broken out separately, but because of the way the funding comes in the capitation payment, it's difficult to break out to see what those actual expenses are. But we do have a report that we can add to our financials that would show, it would be separate from this report, but it would show what our actual expenses are by fund source.
Okay. Yeah, I was just trying to guess why, because to me, I'm looking at these, I can see that those last 3 months are higher.
Yep.
By a significant amount, but I couldn't really tell, is it, gosh, I can't even tell you what colors those are, blue, purple, and green and red? Okay, I don't know which is the green and which is the red, but I can't tell, but I know that they all look the same to me, that's why I wondered. But I knew it was taller.
Yeah.
So it's not by any specific fund source here, but it's by CCHBC revenues coming in?
Right.
Thank you. That was the only question I had.
We did receive CCBHC supplemental. We did an accrual. That was some of the accruals that we did, and it shows how we received I believe it was 3.8 million from settlement. And so there were some settlements from prior years that we received in the revenue as well.
Okay. Yeah. Well, thank you. That helps. Appreciate it. Other questions? Please.
Answer those, Chief Data Officer. I want to go back to the question about the increase in the payment, and I am looking at the publicly published dashboard here for the persons we served, and if you look at that from fiscal year 21 to 22, there was a jump of about 4,000 members increase. Then from 22 to 23, about 1,600. So the number of the people we serve in the rise, and that for sure contribute to the increase in the payments.
Mm-hmm.
Absolutely. No, as a matter of fact, 2023, we are at 28,439. and the year is not done yet. So that's good news too, that we are serving more people in the community.
Sarah, you have a pen up. Are you about to ask a question? Oh, no. Okay. Okay. All right, if there's no more questions, I just want to thank you guys for presenting the financials.
Okay,
Appreciate it.
thank you.
Okay. Next up is the annual plan and budget. All right. Francis, hi.
Hello, good evening. Frances Carley, Deputy Director of Strategic Initiatives. I'm here to discuss a few highlights about the annual plan and budget. We previously talked about this during the last study session in August, so I can go through the plan a little bit more at a high level and highlight some of the changes that have been made since then and provide just a general summary for everyone. This is as a reminder, we are in the second year. FY24 is the second year of the 3-year strategic plan, which goes from FY23 through 25. For FY24 to develop the plan, OCHN's leadership and directors have all been meeting and collaborating on developing goals and objectives that follow this annual or the strategic plan within that framework. So we discussed, as I mentioned, the draft plan during the study session, and we've also provided the final plan, the revised final plan in the board packet, so that's available for review and reference. In developing the plan, OCHN prioritized community feedback, especially from people receiving services. So that was through both the needs assessment survey and then also during presentations around the draft plan. So we did get feedback from the community on the plan itself. So here, just quickly, as we've discussed before, with the needs assessment survey this year, OCHN increased the total number of responses by 11%, and the largest group of respondents was from people receiving services. And I wanted to also highlight for the draft plan how we received feedback from the community. We held 3 different events and presented the draft plan. Most recently, the annual plan and budget listening session on September 6th, which was dedicated entirely to the plan, to the budget, and communicating with the community and getting their feedback. Next slide. So as a reminder, the FY23-25 strategic priorities concern the administration of the managed care system, integrated behavioral health care, improved system of care for children and families, access to non-emergent, urgent, and crisis services, partnerships, advocacy, and community, and then also workforce development. And under the first priority, we have the administration and service delivery focus. And since the time of the study session, OCHN updated the draft plan with a new goal for budget management strategies, which is presented in a little bit more detail further down in the slide deck, and also some training objectives. Next slide. So for the integrated healthcare and crisis priority, some of the changes included objectives for SUD, substance use disorder treatment and prevention, and then also justice services. So that includes supporting and monitoring the progress of the health homes, and then also developing justice services and crisis response training. This also priority also highlighted the post-stabilization services. So I'll pause if there are any questions before moving on. Okay, thanks. Next slide. So for partnerships, advocacy, and community outreach, OCHN this year is really focusing on proactively working with newly elected officials, whether that's at the local level or the state level. Since the study session, we've updated the objectives to also reflect OCHN's ongoing work and partnerships with law enforcement, especially around the crisis intervention team training. Next slide. So for the quality system of care and access, this priority is about developing a high-quality, comprehensive system of care for all populations and services across the network. And some changes since the study session took place include reflecting the jail diversion opportunities that OCHN's justice team is focusing on, and then also exploring some treatment service opportunities for adolescent treatment. Then finally, in terms of recruiting and retaining staff, this priority is focused on the worker shortages, opportunities to maintain the workforce that's needed to meet the community needs. And there were just a few changes here. We added some training objectives regarding providing professional development and training opportunities throughout the entire network, OCHN staff, community members, and other stakeholders in the community. That is a summary of the changes that we included for the priorities, program goals, and really it was just to make sure it was not so much changes, but it's maybe more accurate to say updates to make sure we were reflecting all of the work and all of the departments and had captured everything that should be prioritized. So I'll pause for any additional questions.
Any questions by board members? All right, thank you. We will have a vote on this. It's an action item later on our agenda, I believe.
I did have a couple of updates about or wanted to highlight the budget updates as well. It's just 2 more slides before wrapping up. So as discussed during the study session, the budget was developed in the context of OCHN, the state, the country transitioning out of the public health emergency. Some of the budget factors impacted the budget development this year, including expanded services through the CCBHCs and changes in Medicaid eligibility. And then finally, next slide, please. I also wanted to note that the final annual plan includes the updated budget. So initially, during the study session, OCHN had just received the Medicaid, estimated Medicaid rates from the state the day before. So since that time, the team has and look more closely at the numbers and revise some of the projections. So the new, or the final plan reflects those revisions. So that is the summary of highlights of the annual plan.
Any questions about the budget now? Okay. And I believe this has also got an action item later on in the meeting. All right. Well, with that in mind, next item on the agenda is the approval of the finance of the budget. So I'll entertain a motion for the approval of the fiscal year 24 budget.
Annual plan or of the annual plan?
Well, it says FY 24 budget on the top of the page there.
Oh, she went too soon. We have to approve the annual plan. The
Okay.
presentation you just.
All right, we'll go with the a motion for the annual plan first, which is what I figured we would do. But okay.
I make a motion that we approve the annual plan for FY 24.
Thank you. Ms. Root? Thank you. So we have a motion, we have support or a second. Is there any discussion on the annual plan? Hearing none, we'll go to roll call vote.
Dr. Giles?
Yes.
Ms. Woodruff?
Yes.
Ms. May?
Yes.
Ms. Root?
Yes.
Ms. Newman?
Yes.
Dr. Hans?
Yes.
Mr. Cohen?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. Okay, so now that our plan is approved, we're starting to put our house in order for the next fiscal year, we'll take a look at the Finance Committee items that are up for board approval. First item on the list is our fiscal year 24 budget.
Yes, the Finance Committee recommendation was approval of the budget as presented, and I will make a motion to that effect.
Second?
Thank you. So a motion by Mr. Cohen, second by, oh, John, I forgot your last name.
Young.
Young, yes. Of course it's yes. Second by Young. Is there any discussion?
Just briefly, obviously tonight is the night of the adoption of the budget, which goes into effect October 1st, but a lot of work goes into this over several months. This was discussed at our last study session and at the COW meeting, and we've had an opportunity to review it, but in brief, we have just under $500 million in revenues projected for next year, and a surplus of about $15 million, and I'm hopeful that with some of the new plans that are put into effect, particularly with our provider network, that we can increase that surplus during the year to offset what was going to end up being a tough year, and we knew that that will end shortly on September 30th. So with that, those are just my few comments, but I just want the general public to know, and anyone watching, that we clearly put a lot of effort into the budget, but tonight's the night of adoption, and that's probably why we don't have a big presentation. We already had it, and discussion.
All right, thank you. So with that, if there's any further discussion, if not, I'll have a roll call vote.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cohen?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yes.
Ms. May?
Yes.
Ms. Woodruff?
Yes.
Dr. Giles?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. Next up on the list is the approval of the CMHSP contract with the state of Michigan for this upcoming fiscal year. Someone like to make a motion to approve that?
I'll make the motion for approval.
Thank you, Mr. Young. Is there a second?
Second.
Who was second? Dr. Giles, thank you. So, it's been motioned, it's got a second. Is there any discussion on the CMHSP contract? Hearing none, when we are ready, we'll go for a roll call vote.
Yes.
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 Yes. Yes.
Yes. Thank you. The next item on the agenda is our extension of a contract with Rossetti for continued legal services. So I'm looking for a motion to approve that.
Move for approval.
Thank you, Mr. Young. Is there a second?
Support.
Thank you, Mr. Cowan. It's been moved and seconded. Any discussion on this extension? Hearing none, a roll call vote when we are ready.
Yes.
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 Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Lansman? Motion carries.
Thank you. And the next item on the agenda would be the PIHP contract for the fiscal year '24. Looking for a motion.
Move for approval.
Thank you, Mr. Young. Second? Support. Thank you, Mr. Cowan. Any discussion on the PIHP contract? Yes, sir.
I just want to point out this is a $435 million contract we have with the state to provide prepaid inpatient health plan services, including mental health, substance abuse. This is about 87% of our budget, so it's a contract we don't take lightly, and I want to thank Kalana and the legal team for their review and putting this together, because this is really the centerpiece of our budget, quite frankly, and that's why we're voting on it tonight.
Okay, thank you. Other comments or questions? All right. Roll call vote then. Sheila.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cohen?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Root? Ms. May? Ms. Woodruff? Dr. Giles? Mr. Lansman?
Yes.
Motion carries.
Thank you. Okay, this next contract is for MedVicent, and MedVicent is the company that we use for credentialing of our provider network and our providers and practitioners. So I'm looking for a motion to approve this extension of the contract for $111,000.
Move for approval.
Thank you, Mr. Young.
Support.
Thank you, Mr. Furman. Is there any discussion or questions about this motion or this item? Hearing none, look for a vote for approval on this motion.
Dr. Giles? Ms. Woodruff? Ms. May? Ms. Root? Ms. Newman?
Yes.
Dr. Hans? Mr. Cohen?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Lansman?
Yes.
Motion carries.
Thank you. The next item on the agenda is for motion for DSP training through Easter Seal/MORC. It's for $307,967. It is also a contract extension through December 31st of this year. Is there a motion to approve
Move
this?
for approval.
Thank you, Mr. Young. Is there a second?
Support.
Thank you, Mr. Cowan. Is there any discussion on this training contract extension?
I just wanted
Adam,
to,
yes.
I just wanted to inform everyone that I will be abstaining, by virtue of my employment with the agency.
Thank you. And we are ready. Any other comments or questions? Okay, we're ready for a roll call when you are.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Fruit? Ms. May? Ms. Woodruff? Dr. Giles? Mr. Lansman?
Yes,
Motion carries.
thank you. Next item on the agenda is with TelDoc. They provide telehealth services, and this is a product we've had for many years. It's My Strength. And so this is a contract extension through August 31st of 2024, so late next summer. It's for $30,000. Is there a motion to approve this contract extension?
Move for approval.
Thank you, Mr. Young.
Support.
Thank you, Ms. Newman. Is there any discussion on the My Strength contract extension? Yes, Christina.
Suzanne, are you online? Can you respond to that?
I can. I think I heard. Hi, good evening, everyone. This is Suzanne. I believe I heard the question asking how many participants we have, users for My Strength, and we have about 1,500 users.
And this product is offered to anyone in our county covering that cost. Yes, Dr. Hans. Well, while
I'm
she's...
sorry, I'm having a hard time hearing. Could you repeat the question?
So the question was asked, who is it available to, and how does one register to use it?
So it's available to anyone. Thank you so much. My Strength is available to anyone in Oakland County and beyond. And we promote it throughout the community at different events, community fairs, our newsletters, online, through our constant contact communication. And they can register through My Strength. They go to the My Strength website or through the app, and we give them an access code so that they can access it through OCHN. You're welcome.
And just so you know, I believe it's an all we can use contract, which means we're paying a flat fee. So everyone in the county, theoretically, all million souls, could register and use it if they choose. I know. I know that. Thank you. Are there any other questions? Hearing none, we'll have a roll call vote for the approval of this motion.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cohen?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Root? Ms. May? Ms. Woodruff?
Yes.
Dr. Giles? Mr. Lansman?
Yes.
Motion carries.
Thank you. Next item on the agenda is our anti-stigma community outreach program through CNS Healthcare. Yes, Ms. Newman. Oh, we haven't made the motion yet. Okay. So it's an approval for a 12-month contract extension for $344,631. It's a contract extension for the 12 months for the anti-stigma program.
Move for approval.
Thank you, Mr. Young. Is there a second? Thank you, Ms. Woodruff. Is there any discussion or questions, comments? Yes, Ms. Newman.
I would like to abstain from this vote due to my employment with CNS.
Okay, thank you. Is there any other comments or questions? If not, we'll do a roll call vote when you are ready.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cohen?
Yes.
Dr. Hans? Ms. Newman? Oh, you're right. Ms. Root? Ms. May? Ms. Woodruff? Dr. Giles?
Yes.
Mr. Landsman? Motion carries.
Next item on the agenda is Clemente Siegel design. This is for architect and engineering services. It's for a 3-year contract extension for $45,000.
Move for approval.
Thank you, Mr. Young. Is there a second?
Support.
Thank you, Dr. Giles. Is there any discussion on this contract extension? Hearing none, we'll do a roll call vote.
Dr. Giles?
Yes.
Ms. Woodruff?
Yes.
Ms. May? Ms. Root? Ms. Newman?
Yes.
Dr. Hans? Mr. Cohen?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. I think that covers the Finance Committee's recommendations and regular contracts, so we move on to the consent agenda. So the consent agenda is of approval of meeting minutes and meeting minute reports from the Recipient Rights Advisory Committee, Committee of the Whole, Citizens Advisory Committee, and the Substance Use Oversight Board. So I'm looking for a motion to approve the consent agenda.
Move for approval.
Support.
Thank you. It's been moved by Mr. Young, seconded by Mr. Furman and Ms. Newman.
Tie vote.
I'm sorry?
They tied, yeah.
Yes. Okay. And we'll need a roll call vote to approve this consent agenda. There is no discussion on consent agendas.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cohen?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Root? Ms. May? Ms. Woodruff?
Yes.
Dr. Giles?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Okay, thank you. Okay, now we're at other business. So it was noted earlier this evening that we currently have a contract extension for 60 days that will expire on, with our CEO, that will expire on Friday, October 13th. However, our next board meeting isn't until Tuesday, October 17th. So I'm entertaining a motion for an additional 30-day extension if needed by our board as we try to reach contract completion and approval with our CEO.
So moved.
Support.
Thank you. So it's been moved by Mr. Cohen, seconded by Ms. Newman. Is there any discussion on this motion? Yes. Christina. Yeah. That's, yeah. Yeah, right.
Yeah. If I heard the question right, do we need more time?
No, I'm saying instead of a 30-day extension, could we do a 1 week and just be prepared to vote?
We have given, after today's meeting, a full week, so I think we should, do the 30 days, because that takes us to the next, we have to really vote at a board meeting on this, not at a
Committee
study
of whole
session or
study.
a cow meeting for it, but I appreciate the sentiment, but part of the difficulty in this kind of thing is that, the entire executive committee has, gathered as we've went through each step of the discussion, and unfortunately, we we generally can only meet on the days when we have our meetings. So that's created a little bit of a, that's a little longer than normal situation. So, but that's in the spirit that everybody on the committee is involved, everybody has their say, and that we respond appropriately in the back and forth between with Dana and her legal counsel. So that's really what's happening and why it's taken a little bit longer.
I also want to point out is once we've reached, and I assume we will, I'm hoping we do, it's retroactive to the end of when the last contract expired. So it's not like it's going to take effect at the next month or the month thereafter. It's just giving us the time as an executive committee to meet on this topic. Okay? So I didn't mean to put you in a corner when I asked you about that before, Dana. But if you had said no, that would have told me you have no interest in us moving forward. And I didn't think that was the truth.
I just wanted to make sure I was
Yes.
with my attorney.
Yes, it has nothing to do with the approval of your agreement. All about let's stay in this game of getting to an agreement. Okay. Does that clarify? Are there any other questions about why I'm asking for that? Just because of the calendars. All right, so now I'm looking for approval of that motion.
So moved.
We need a roll call. What?
We already had a motion.
I'm looking for the vote on the motion.
Oh, for me?
Sorry, yes.
Oh, okay. Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cohen? Yes. Dr. Hans? Yes. Ms. Newman?
Yes.
Ms. Root? Yes. Ms. May?
Yes.
Ms. Woodruff?
Yes.
Dr. Giles?
Yes.
Mr. Lanson?
Yes,
Motion carried.
thank you. If there's no other business, other business, yes, then we'll move on to board reports. Dr. Hans, I think you may have a report for recipient rights.
Board meeting. The budget for fiscal '24 was presented by Eddie Brown. There was a lot of discussion on that. One of the issues that came up was that there should be a presentation by the finance office to kind of explain to the committee the different funding sources and the process of development of budget, which Patrick very kindly agreed to do at a future date. Susan Wainert made a presentation of Medicaid reauthorization and the update, and on this subject also there was a lot of discussion. People are experiencing a lot of challenging in completing the application process, and one of the issues is that there is not enough time. They usually get about 1 week to prepare the application and collect all the documentation that is required. So Dana can probably explain a little bit more the OCHN's effort in that regard to help people navigate this complicated process. And this is, some of people are finding it very overwhelming. So I wanted the board to be aware of that. The site review has been completed at about 72%. The required compliance is at 97%. The lag is due to, mostly due to inpatient services and some of the other issues. We expect that to be completed this month. The next meeting of the committee is on October 5th at 4 p.m. I will be out of town from October 4th to 14th, so I will not be able to attend that meeting, and I'm requesting if anybody would volunteer to present at that meeting on our behalf.
Let me look at, I'll look at my schedule.
Having been on that committee myself, I'll tell you, it's always interesting to discuss, to go on about policy. Check your calendars, I'll check mine as well. And, I'll tell you what, reach directly out to Bajaya, to Dr. Hans, if you can cover, and if she gets more than one of us, hey, I know that committee won't mind having more than one of us attending, because they're very active. Okay, thank you. Next up is the CAC. Ms. Newman?
I do not have a report for last month's meeting. Our meeting is tomorrow at 9:30.
It's a good reason why. Do you have, can you look in the magic ball to know what they're going to cover tomorrow? I don't think so either. Okay, thank you. And for SUD, the Policy Oversight Board, Sarah May?
So we originally had an oversight meeting scheduled for the 7th, but it was rescheduled for this Wednesday, or this coming Wednesday, September 27th at 4 p.m.
Okay, so we'll have a report next month. Okay. All right. Next up on the agenda is public comment, I think. It is. So a second opportunity of the night. Is there anyone that's in the room that would like to make any public comment? Is there anyone remote that would like to make public comment? Not hearing any, and there's always public comment available at all of our meetings. So we look forward to your feedback, the good, the bad, whatever. Thank you. Next up on the agenda would be our director's report. Dana, you have the floor.
Good evening again, and thank you. September is Suicide Prevention Month, and so we've been actively in the community doing quite a few things to make sure that we are looking at preventing suicide, talking and sharing stories, and also reminding people about our zero suicide policy and things that we do to work with the community to save lives. So recently I attended an event with the Southfield Police Chief as well as I believe it's Farmington Hills and Oak Park, and talked about our collaborative efforts in terms of training officers with our CIT and co-responders, but also the work that we're doing together to make sure we're educating the community on the resources that are available and really working with our partners such as the 988 and also the National Suicide Hotline. So it was a very great turnout, but also a lot of great information and a lot of families who shared their personal stories about surviving or managing the aftermath of losing a loved one to suicide. So it was very powerful event. The other thing that was really important to celebrate is the Walk a Mile rally in Lansing last week. So we have to give our communications team, our recipients rights director, and our chief of staff, who don't like a lot of accolades and kudos and attention because they just are so committed. But without Vicki Suter and without Christine Burke and all of their teams and the work that they do, this event probably would not be as successful as it really is. So a lot of people join into the success, but I really have to acknowledge them and their work that they do to really make it something that gets bigger and bigger every year. So don't hide, Christine. The other thing I wanted to talk about coming on Thursday, and I would love if any of our board members in the community could attend, our OCHN's annual recovery celebration is this Thursday. I believe it starts at 10 a.m. Yeah, thank you. And it's right here in our parking lot. It's a huge celebration. Last year, I think we doubled in attendance from the previous years. Of course, the public health emergency didn't help, but once we restarted those events, the last 2 years, they've been extremely successful. This year, what I would say is that the Oakland County Health Department and Oakland County Exec Deputy Director Madia Tariq are both going to be present and working with us to make sure that they're facilitating listening sessions for the opiate settlement dollars. So they want to hear from this community, they want to hear from providers, they want to hear from all of us about what they can do to utilize those dollars that they're getting to really look at the opiate crisis and address the need of the community. In terms of collaboration, I just really wanted to break down my report in a way that you really can see the different things and the different areas that we're covering. I'm happy that I was reappointed to the Michigan Autism Council by the governor, and it gives me another 3-year term. The other thing that is involved, and it really helps us to have a seat at that table as a representative of the PIHPs and the CMHSPs. So that is a great benefit for all of us. Also, the CMHA, the Community Mental Health Association, has asked that I serve on the Diversity, Equity, and Inclusion Advisory Group, which will be the first day, that Saturday of the fall conference. The other thing I wanted to highlight was the Tri-County Summit. The Tri-County Summit was a collaboration between Oakland, Macomb, and Detroit-Wayne, and they focused on law enforcement as well as the mental health in the jail community and the courts. It was well attended by all of the Board of Commissioners, or I'll say most of them, who really got to hear a lot more about our programs in detail from Macomb and from Oakland and Detroit-Wayne that typically would not be able to hear the level of detail. And so after that event, I will tell you that there was a lot of questions about what we're doing and wanting more and more interest about expanding the law enforcement or justice initiatives, I should say, that we are actually really involved in, and we have a great team with Trish and Dr. Posios. So I think the more we're out there and showing the benefits through the numbers of people that we're serving, the more support that we're garnering from Oakland County Exec and the Board of Commissioners. And that is, in the end, going to benefit the people we serve. Just a few data points in terms of our access team. They actually had a call center, or changing their call center tool that they use. I don't have the technical name for it, but our new director of IT led that team in helping us implement the new call center tool, Landis, and I think everybody is so far very pleased with the outcomes, so thank you for that. The other parts that I wanted to talk about have to do with our crisis services and our participation in I already repeated myself. I'm sorry. I did want to highlight the SUD work that our substance use disorder director and the team are doing in terms of serving uninsured individuals who need substance use treatment. We don't highlight that enough. The Sober Support Unit is really one of I don't think there is another one that is actively working in the state. So I know there are other places and people who are wanting to do this model of the Sober Support Unit, but actually the one that we use, we have served 75 people just this month alone. So I think that's something that we really need to highlight when we're talking about access and informing the community about the work and the services that are available. Let's see. And then the other big highlight, I can't stop with highlighting the work that we're doing in the justice arena with our community threat assessment. We know that with the tragedy of Oxford, we know that that community has a great need, but it also demonstrates the need of the entire Oakland County as well as the state. And so we're taking the lead through the work that Dr. Posios is doing and his team, the Justice Initiative team with Trish and Suri and all of their team members. They're really taking the lead, and we recently had a community threat assessment training with more than 30 partners, including the FBI, Oakland Intermediate School District, and Wayne State University. So big kudos to that team who's doing the work and making a great impact on the community in that effort. So that's all I really have, and I'm open to questions.
Yes, Ms. Root.
Sure. Oh, good.
I think it is really important to highlight that the 27 underinsured individuals were helped, because number one, it's hard to reach out for help when you're going through that. And then number two, access to services is a big deal. And it reminds me, a couple months ago at La Familia, I took a phone call, and a family member of a Spanish-speaking immigrant was trying to find substance use disorder help. And I suggested going to Common Ground, and they said that they did, but I think because they were uninsured and didn't have a social security number, I don't think they could receive help. So I just want to clarify that.
That is not true, and that should not be a barrier to receiving services. That's where we have grant dollars and things of that nature. So when that happens, please let me know as soon as possible so we can get that person connected, because we don't want to go that period of time and not make sure that they stay connected. I think there are a couple of board members know that they can call me anytime or call Kim or anybody on our team to make sure, because we won't want people to walk away with a no. They should never be walking away with a no and no kind of connection to services and supports. So even if that individual is still interested and have a need, please let one of us know so we can follow up.
Okay. Is there a specific name? Like, I know CCBHC is for mental health, and that serves those who may not have insurance. What about for substance use?
CCBHC also serves individuals who have substance use disorder treatment needs.
I guess I didn't realize that. Okay, thank you.
You're welcome.
And then I just had one more question. For the threat assessment, when the Oxford tragedy happened, I was working through Honor Community Health in a Pontiac elementary school. So they have the school-based mental health clinicians. And that was a question like a lot of us were receiving, is if we could provide those threat assessments, but we didn't have any special training for that. So I was just wondering, is that team a part of our efforts or being trained at all? Or has that been in conversation?
Dr. Pozios, do you want to answer?
I'm sorry, could you clarify which team you're referring to?
Yeah, the behavioral health clinicians that are school-based through Honor Community Health, they're placed in different schools.
I don't recall if we have specifically invited them yet to one of our trainings, but we're constantly looking to expand the pool of people that would benefit from such training. So we will definitely keep them in mind going forward. It's our hope that our community threat assessment team members will be available to the schools that are open to, our involvement and our availability to be members of the threat assessment teams that are based in each school. And so it's definitely a process in terms of how we are integrated into these schools, because at the end of the day, we need to be welcomed in.
Sure, yeah.
But I think that's a fantastic idea.
Yeah, just having the information would be so helpful, right? Because sometimes principals might ask the clinicians, and then they're not sure who could help with that.
Yep.
Okay.
Absolutely. And I do want to highlight that our own Tricia Zizumbo is a trainer in the behavioral threat assessment and management training that has been conducted at the Oakland schools. And so she's going to continue to be involved in providing that training to school staff going forward.
Okay. Thank you.
You're welcome. Thank you.
There's also, Kyle had responded in the chat. I don't know if he wants to speak.
Sure. Hi, I'm Kyle Glasgow. I'm the Director of Access and Crisis. The Resource and Crisis Center has a sober support unit. They are available to assist anyone who's struggling with that. Insurance is not a factor. They can walk in and get a referral to treatment, regardless of who they are or where they are.
Okay, thank you so much.
Other questions or comments for Dana, our CEO? All right, thank you. Next up, our board comments. I'll start to the left, because I usually start from the right. Christina? Vijaya? Sarah? John?
I want to thank Patrick and the team for the finance report, and I know the amount of work that's going into it. And also for the board colleagues, this isn't over. This is going to be a long stretch. We are just getting into the redetermination, so every month the finances are going to be important, and I do appreciate the fact that we are not having to guess at what the accruals really are. So thank you and your team for the efforts.
Okay.
I don't know how many people were aware of the fact that the state had changed the, telehealth. They had changed telehealth, and they had prohibited peers from being able to perform services through telehealth. And I just want to report that they reversed that decision, and it went retroactive back to May. So sometimes the squeaky wheel does get the grease, because there was a lot of peers that were very upset about that. Thank you.
Thank you. Dennis?
Just two things. One item I forgot to mention in the motion on the budget is that the budget for the coming fiscal year shows our organization and its costs at less than somewhere between 6 and 7%. I had it written down. I can't find it from our discussion last week, and I believe that shows a very lean organization. It's an organization that sharpens its pencil, and I would compare us to any other organization that's providing services and overseeing the expenditure of close to $500 million in the coming year. So I want to applaud everyone in the organization who's been part of that and really help us recognize our mission, which is to get as many dollars out the door. And any organization that has 93% of the dollars going out the door, I think, is run well. So I applaud everybody for that. The second thing is, I attended Saturday, my wife and son and I, the Angels Place, which is a community home provider, had a family fun day at Royal Oak Farmers Market, of course, which is close to my heart, living in the community. And, I've been big on these events because a lot of them have gone away, and this was just an outstanding event. And it was great to see so many people that are both involved with the organization, but also it was open to the public, and there were other families and individuals who came, and they had just a great event, and I applaud them for doing that and having a social event there was all kinds of games and prizes and, not for me, for the individuals we service, and it was just, it's good to see that kind of activity and the smiles on the faces of everybody. And I know there's other organizations, I'm just picking one, but there's a lot of other groups out there who are providing services to those who need them, and especially on the social end of things.
Okay, thank you. You bet.
It was great to hear about the Fellows Program, and especially the psychiatrists that are interested in working with children and adolescents, because there is a great need in this area for that. And kudos to Dr. Posio and the rest of the fellows. Also, I have registered for Thursday's event, so I will be here.
Okay. Yolanda?
First of all, I want to say Ms. Woodruff took the words right out of my mouth. So I wanted to thank Dr. Posio and the fellows for attending tonight and sharing the details of your program. I wanted to congratulate you all. I heard PGY 3, so you're in your program year 3, so it's all downhill in my opinion now. You made it through the hard part. Now you get to sit back and just learn so that whatever you absorb, you'll be able to help the people you serve. So congratulations on that. And some very strong programs. So, of course, alumni, U of M, of course, but then also the Authority with Dr. Carey. Very strong program director, and Henry Ford as well. So just thank you all for coming up.
Thank you. Adam?
Yes, I'd just like to thank, Frances for her overview of the updates to the annual plan. And again, thanks once again to, any and all staff that take the time to put these presentations together. They're always informative and well received. Thanks a lot and have a great night.
Okay, thank you. And I want to thank Suzanne for news that we can use, Patrick for watching the checkbook, if you will, Francis for giving us our budget and our plan, Nasser for being data-driven, Dr. Pozio and your three fellows, McLean, Vaughn, and Locke. So it'll be interesting to see how we can leverage their learning amongst the folks here in our organization and the folks that we serve. So thank you all. At this point, there's nothing left on our agenda, so I wish you all good evening, and we are in adjournment.